All right, you're on air.
Should we do the lecture or just ignore it and we just go from it?
Let's go with the. Let's try to find out who's who, why they're here, and then we'll
Yeah, it
formulate.
can be.
Yeah. Who's is it?
Yes, many of them.
Nick Dash is going to be coming in next second.
At least 4 of you are new, so that's why.
Yeah. Let's try to find out why they're here.
Okay.
Can you pass on the sheet to? Okay.
The phone doesn't work,
You,
no, this one works, but the other one.
they'll call with cell phone. Do I say, did I spell your name right? Oyin?
Oyin.
Yeah.
Yes.
Cool. That's what I thought. Why you, okay, we'll go around the room.
Okay. I forgot to. Thanks.
Please sign.
She did.
If you don't, okay. Thank you. Thanks.
This is yours.
Yeah, put it.
No, you're the name, right?
Oh, okay.
Oh, Nick.
Good afternoon, guys. Thanks for coming by. And this is a course called Evidence-Based Entrepreneurship. Normally we do a few things. We approach it in a lecture workshop format, but because of the feedback and because of the kind of situation, a small room, I'm trying to make it slightly different this time and not bore everybody with a lecture of an hours worth of work, but go straight into what the main points of it are. And as we're going to do the practice sessions, there'll be ample opportunities for me to give you the background as needed about what we are doing. So the way to start out, what I would like to do is go around, introduce ourselves, each of you guys, and tell me about yourself, what you're doing with respect to entrepreneur. It could be you're thinking about it, you're doing something about it, or you already have a business, whatever state you are in, and what kind of challenges that you faced or expect to face in your entrepreneurial activity. This is about health innovations, health innovators, so anything relating to healthcare, your experience would also be very relevant in the conversation. So to start off, my name is Mohan Venkataramana. I am an entrepreneur of about 20 some years now. I've had several startups, and some of them still continuing on. And I build products, design, develop, build, market the products, and make some money out of that. That's my focus. And I have product.
Yeah.
Yes,
Hi.
please, come on in. And you know to fill up.
Sure.
And I do a lot of projects in multiple verticals, including healthcare and many other verticals that are sort of connected with that. And I have a team of about 10 people whom I manage. And we have been trying to build additional resources as we get more money and all the stuff. So that's what my background is. So you want to start with?
Sure. My name is Viren Shah. I'm a I guess, a retired individual. Retired meaning I'm over 65, meaning I'm officially retired. So I'm looking for a second career. I have a science, marketing, and sales background, and I'm utilizing this forum to learn new ideas.
Hi, thank you for having us. My name is Nikta Hamidi. I just came across your group this morning and thought it sounded interesting. I'm a biomedical engineer by background. Also, it's an interest in public health and science policy. I work at IBM Watson Health. Not working on anything entrepreneurial right now, but always open to like seeing what's going on out there. New to the area as well. Just moved to Boston.
Where are you coming from?
Cleveland.
Oh,
Yeah.
Nice place.
Yeah.
Very cold though.
Yeah,
Okay,
Boston's
right.
better.
I know, right?
Yeah.
Wherever it is notorious.
Yeah.
Always.
I used to live in Columbus. I think
Oh,
there are
really?
stories about cold.
Yeah, well, it's all cold to me because I'm from Phoenix, where it's like
That's right.
always 100 degrees. So, but I'm really happy to be here, especially in an area where there's so much going on in healthcare.
Go ahead.
Hi everyone, I'm Fatima Shazad. My background's in public health and business.
Okay.
We actually went to grad school together, so Nikta found this event and tagged along.
You also work at IBM? What's
No, actually, my day job's at the VA. I'm working on the All of Us research program, so looking to recruit over 1 million patients from the US for a genomic study, which is really cool. That's like I work on the operations and the marketing and communication side of things, but on the entrepreneurial side, I work at a company called Medumo. So we focus on clinical adherence to procedures and instructions for procedures. So for example, colonoscopy, if a patient needs to stop taking meds at a certain time, if they need to start taking their Miralax at a certain time. It's interesting because we're not necessarily innovative, but we like to think of ourselves as sending the right message at the right time through channels that actually work. So we don't sound very entrepreneurial when we say we're sending text messages and emails, but those are actually very effective and more effective than apps or platforms and things like that that have a high barrier. So I'm really interested in learning how these sort of, I don't want to call them basic, but how these ideas how these concepts of text messaging and email are applied to the pain points in healthcare today, and seeing what other people in the space are doing in regards to that.
That's wonderful.
Great. By the way, I just, so you're a public health plus, you said something?
Yeah, business.
So you're a public health plus business major, and right now you're working at VA doing patient recruitment?
Yeah, operations for an NIH study. Yeah.
NIH study.
Yeah.
Is this related to precision medicine and things like that?
Yeah, it's actually it's the 21st Century Cares Act, the PMI initiative.
Okay.
Yeah.
Great.
So the VA is running. They're one of the health provider organizations that's recruiting part of the 1 million patients.
Great. Okay, and Medumo is clinical adherence, right?
Yeah, they're a startup.
Okay.
Just in the Boston area.
Thank you.
Yeah, sure.
That was great. I learned a lot about you.
That's the benefit of it. Completely unrehearsed, but that's the way it happens. Okay.
Hi, my name is Dipti, and I came to know about this event just 30 minutes back. I came to attend an event at MIT, and I was staying with him as an Airbnb. He talked about healthcare, and I work in healthcare, so I kind of got excited, and I said, I'll just go in and see, what all stuff you're working on.
Welcome.
And my background is in healthcare. I worked in revenue cycle management for 2.5 years, and then I moved into supply chain management. But the industry has been healthcare for me.
Okay.
Hi, I'm Sehil.
Oh, I'm so sorry. We need to talk to him about that, my hospital bills.
Yeah, I would love to.
Sorry about that.
Yeah, really.
All right, so my name is Sehil. I also have a background in public health and business. Well, I'm originally a physician, trained in internal medicine, decided that public health or business is more appealing for me, so I decided to switch my career, did grad school, and recently started working at the Mass General as so the official title is just a research fellow, but what I'm doing there is so the lab is working on artificial intelligence, deep learning to analyze medical images And what I'm doing there is clearly I don't know anything about software engineering or coding or anything, but sort of helping them to, start the research based on the user needs and what the physicians and what the healthcare professionals want, and sort of translate the research into business kind of thing. So yeah, sort of building a startup based on our research is our ultimate goal for now.
That's really cool. So primarily, can I say that you're doing market research for that?
That could be part of my job, but primarily I'm doing more like study design and working with a lot of companies that are interested in our research to make it as a business,
I see. So you're doing business development.
sort of.
I see. So the technology is already ready at MGH.
Well, we are developing that too,
I see.
but yeah, we want to develop a business at the same time.
Cool. Thank you.
So I'm based on the hospital at the research side, so
Gotcha.
I can't really say that I'm doing business development, but I'm sort of like business person at the lab.
Welcome.
Thank you.
Hi everyone, I'm Danette. I'm originally from Colombia and I moved to the US in 2010. And as I was sharing with Mohan that I changed from marketing to healthcare or transition per se. My major is in marketing and currently doing my MHA at Suffolk University. And I'm doing my internship program, my internship at Tufts Medical Center. And with them, I'm doing building a website for the Center of Treatment, Comparison and Integrative Analysis. It's a very long name, but in short ways, it's CTCIA. So I didn't have any background experience on building websites or anything like that. And I feel my entrepreneur skills came out, and I've been able to build this website and help them with the whole marketing plan. It's going well. I can actually share some of what I've done with you guys, and you can give me some feedback.
It's fantastic. You said
CIA.
CTCIA. What is this compression?
So it's Center for Treatment, Comparison, and Integrative Analysis.
What does that mean?
As the name say, we do a lot of comparisons. So basically, it's a data analysis business model and / consulting. So what they do is basically they analyze some of the data that pharmaceuticals provide. And with that data, they help them to take the decision, so to go or no go decision, or different decisions throughout the life cycle of the drug. So is it for clinical, the clinical, in the research part, like basically they analyze all the data and they help them take the best decision
Gotcha.
to go forward. Yeah.
Awesome. Now I understand what it is.
Yeah.
They should change that name.
Yeah,
You
so,
understood?
Basically, they're making strategic business decisions based on data. Primarily, they look data analytics and things like that.
Oh, she talked so long and you said. Is that right or is he just making it up?
See,
no, it is.
She's right.
big lesson right here. Marketing people and healthcare people, totally different terminology.
Yeah.
Marketing people is about understanding. Medical people make it so complicated and it sound like engineering.
You have to impress people by saying complicated words.
I know. But at the end of the day, other person is not understanding it.
They're not supposed to understand it. That's the whole idea.
Oh, well, talking about different careers and different things, my name is Silva. I graduated as an accountant, and I made a big transition into doing personal training, just because I know they're I prove myself that after having a trainer for a long time, eating healthy, I I identified some illnesses that I got genetically transmitted from my family. So I'm very interested in like healthcare, and so I work at a small company. We're still growing, and I'm always, you know, open to learn and get some advice for other entrepreneurs, and you know how like healthcare is very related. Like, and I always think that exercising and eating healthier food. So I have a background in nutrition too. So always preventive is my thing. Like I believe like no pills can cure you. You can prevent all those things. I mean, once you got there, and it's a little too late. You can start over, start. But I do consider like is it's obviously based is proven that all these prevents all these illnesses. And I'm nothing against pharmaceuticals or anything, but like I'm very like natural eater and exercising. I try to transmit that to people. So that's why I'm here and I want to learn more.
Great, welcome.
Hello everyone, my name is Oyen and I'm studying my master's in international marketing at Holt Business School, which is right in front of the Science Museum. And I don't have any medical background except for I can say that I have my sister is a medical doctor, which is not like as if I'm in the public health industry, but it is close to. That's basically more like it for now. But I usually come here because I get to meet people and I get to learn new things and also hands-on experience on different things. Like on Saturday, there was training for the Python class and also the Facebook chatbot. So it's not just about health industry, but it's more like if you have an idea or if you can give feedback on an idea, marketing or anything. So it's although it's health innovators, but there's a lot to it than the name says. So that's why I like coming here.
Thank you so much. Yes. Good evening, everyone, and welcome. So good to see you. Oops, we got a visitor. My name is Cal. I'm the founder of Health Remedies. I started Health Remedies 5 years ago in this building. I'm a physician and a pharmacist by training and education, and I come from India. I've been in America since 2000. In America, I work for information technology for corporate America for 12 years. 5 years ago, I got my green card, and I started pursuing my passion, that is connecting healthcare and technology together. That's the skill I learned, and I wanted to connect that. And I came to America to make a big impact, and I figured I can only make so much impact, and I want to empower everybody to start something and to do something, and I want to help them. So with that effort, we started Health Innovators, and we've been helping a lot of people. And hopefully, Boston is full of talented people. Hopefully, we want to gather all this energy, and hopefully, we want to do great things one day. Thank you so much for joining us.
So with that, basically, I'll give you a very abbreviated background about what we are doing. The title of this is evidence-based entrepreneurship. Another way of saying is another way we say it is how to start a startup. So somebody who has an idea, assuming you want to start up, that's it, you don't know what to do next. You have the idea, you have interest, but you don't know what to do. And the general trend is to be able to write a business plan. Traditionally, people write pages and pages of business plan, which is irrelevant. We go through an exercise where we build a business plan, which is pretty much this form. This is entirely the business plan that we'll be writing. And in order to do that, we just summarize everything you have, consolidate everything into the one page. And this page will provide all the information that is relevant for somebody to understand what you're doing without having to read lots and lots of pages. That is the primary goal of this. So we will be taking ideas, either your own or hypothetical ideas, and we'll be working as smaller teams, and we will work on these things. The key thing is when you start a business, you really don't know what to do. So you start with somewhere and you make a lot of assumptions. And you have to test each of the assumptions. That's why the evidence-based entrepreneurship comes in. So the entrepreneurship is essentially an experience in trying things, finding what's wrong, and pivoting around it. The sooner you do, the more likely you'll succeed. Entrepreneurship is a team exercise, never alone. And team means that the team should be sitting down working with this. So to practice that, what we will do is break it into teams of 3 people or 4 people, depending on what it is, and pick an idea. That idea could be, if you're already thinking about an idea of doing business, you can as well use that chance to, build a compatible kind of people to come there and discuss your idea. There is nothing secretive about your idea. We assume that we will respect each other's intellectual property. So if you like somebody's idea, join with them, don't compete with them. Basically, it will be fun to work with somebody else. 2 people who are, it's like, 2 or more people who are interested in the idea, working together will be more fun, and it will be rewarding. If you don't have any such ideas and your team happens to pick any idea, or we have a bunch of stuff that we do in healthcare that we can propose, and you can pick any of the ideas, and you want to do something, you'll probably be part of that. So that is by and large there are a whole set of questions you should ask. So when you look at this page, central to the page is the value proposition. So when you say, I have an idea to build something, the first question you want to ask is, what is the value you are providing to the customer? Try to make a list of them, 3 or 4. You may have multiple stakeholders. So each of them value may be different for different set of people. So if you have a situation where you have multiple stakeholders, identify them, and for each of them, identify 1, 2, maybe 3 value propositions. You don't have to make an exhaustive list of it, but the top or most important ideas, value that you think you can provide. The second thing is the customers, customers on this side. So once you have this, identify the customers who is going to derive that value. Identify who they are. Try to define the demographics as closely. Is it 20 to 30-year-old? Is it physicians? Whatever characteristics you want to pick that defines the target market, and see what the value proposition, how that relates to that. Now, there are lots of other pieces here. When you first do a value proposition, you will usually fill up all the things at a high level. Try to fill up as many columns as possible. Okay, you may not have all of the details. That's okay, but try to fill up as much so as to get an overview. Then the second step is to focus purely on the value proposition and customers. And if you look on the back of the sheet, you have the those 2 are listed with a few more questions. This side is a value proposition, and that is the customer, and there's a connection between the 2. So when you start filling out these things, you will go through the brainstorming session, you will go through the discussions of each other, and let the discussions flow, even when you're doing this also. Let the discussion flow organically. Don't try to constrain yourself saying it's not like as if this is an exam and you have to answer. That is not the goal here. The goal is to let the discussions flow naturally and derive things out of it. You'll find for a long time you might be digressing far away from what it is. That's okay. But eventually you'll come to the crux of the problem. That's what you're interested in, and you want to do something about that. In each of the cases, my interest is when you write something, whether it's a value proposition or the customer demographics or the channels or the key resources, anything you write there, I want you to ask the question simply, how do I know? I wrote some value proposition. This is going to reduce the cost. Ask yourself, how do I know? This is going to help customers get more something better. How do I know? Keep the question, how do I know, or how do you know, as a question, and try to answer. Answer is, what more information do you need, evidence, to convince somebody that whatever you're saying is true? I'm going to decrease the cost. How do you know? I asked 10 people, or I know comparative this product. Almost always you should be getting externally validated evidence. That will tell you whether you're right or wrong. And so almost always the answer, the next step will be, after you say, how do you know, and you write all these things, will be you'll be going to talk to your customer, ask 10 customers, whoever that may be, and where you have identified, and ask those people, collect the information, bring it back, discuss that with the team, and along with that you'll get the answer. What you thought may be what is a great idea may be totally meaningless. The customers don't care. If you know that, if you ask 10 people and 8 people said, no, it's a lousy idea, it'd be better for you to rethink what you're doing. Maybe that's not a good market. Should we reposition yourself? Might be worth, or maybe the 2 people are the right one. No, you cannot bank purely on whatever your statistical numbers say, but you should take the data with your intuition and convince yourself that it's the right way you want to go. So this is the crux of the whole thing, what we talked for a whole hour. So what we will do is organize ourselves into teams. We are 9 people here.